Okay, this question was asked by one of you. So this is how the question goes. Please help me. Please help me because I've written it somewhere. Please help me. I've been using hormonal contraceptive and I'm trying to get pregnant and I cannot get pregnant. So guys, in this video I'm going to show you some of the things that you're supposed to do. And before that, let us look at this hormonal family planning. Of course, we have so many family planning. We have the barrier methods, we have the that is under artificial family planning. We have natural family planning and artificial family planning. So, and under artificial family planning, we have the hormonal and the non-hormonal. So, let us look at this hormonal family planning. So, what are they? Or if we talk about hormonal family planning, do you even know what this hormonal family planning does? What are the mode of action first before we look at them? Hey guys, welcome and welcome back to another video. So in today's video we are going to talk about how to get pregnant faster after using family planning. So guys, if you have not subscribed and you are watching this video, I don't know what you are waiting for. Kindly subscribe, like the video, share and comment. Don't forget to turn your notification bell and tell me in the comment section what you want me to talk about in the next video. So under hormonal family planning, we have the pills, we have the injectables, the Provera, we have the IUD or IUCD, we have the implants, the depot and the jet, not the depot, the implants and the gel. So all these hormonal family planning, they work almost the same, and we have three modes of action in all this artificial family planning, hormonal family planning, whether it is a pill or it is injectables or implants or IUCD or IUD. They work in a similar way. It is only you to decide which one suits you better according to your hormones. So let us look at the mode of action of all these hormones first, and then I will tell you what you are supposed to do when after using all this hormonal family planning and you are trying to get pregnant. All this hormonal family planning, they suppress ovulation. So they suppress ovulation, and you know very well that when you are not ovulating, then you cannot get pregnant. So that is one way of how they work. The second point, they make the womb unfavorable for implantation to take place. You know, after fertilization has taken place in the fallopian tube, the fertilized ovum has to travel to the uterus to get implanted there. So this hormonal family planning make the uterus or the womb unfavorable for implantation to take place. So even in case if you get pregnant or if fertilization has taken place, the ovum will not get implanted into the uterus. Another third mode of action is they make the cervical mucus thick, whereby now the sperms cannot swim through easily to go to the fallopian tube to get to fertilize an ovum. Yes, that is how they work. They suppress the ovulation, they make the uterus unfavorable for implantation, and then they make cervical mucus thick and the sperms cannot swim through easily to get to reach the fallopian tube. So now let us answer your question, how to get pregnant faster after using this hormonal family planning. Number one, the first thing you will do, you know, this hormone, they sometimes usually imbalance your hormones. So the first thing you are supposed to do is you give yourself at enough time for the hormones to be balanced. Yes, don't stop using, like for example, you have stopped, some of you just stopped using a particular family planning, or you have just stopped using pills or the Paparovera, any family planning that you are using, and then you want to get pregnant the next month or the next day. It won't happen like that. Give yourself time, enough time for you, for the hormone to be balanced well in your body. Yeah, yes, give yourself enough time for you to come back to fertility phase. You know, when you are using this family planning, you are always infertile, so give yourself enough time for you to come back to fertility phase. Don't rush, don't stop using, like you've stopped using family planning today and then you want to get pregnant tomorrow. It won't work. It won't work because the ovulation has been suppressed, the cervical mucus is thick, and also the womb is not favorable for implantation, so it won't work. You will stress yourself, you will continue stressing yourself, you will continue using some of the fertility pills, which will not sometimes help you before you come back to fertility phase. Number 2, track your cycle and know when you are ovulating. Some people doesn't know the signs of ovulation. If you are a lady and you don't know the signs of ovulation, then you are not doing yourself any favor. You are doing yourself an injustice that should be taken to court. So you must know, you must track your cycle well and know when you are ovulating. So how will you know that you are ovulating? First, you have to know the signs of ovulation. So what are these signs of ovulation? Number 1, bloating, which most of the people won't experience. Number 2, nausea, which most of the people won't experience. And number 3 is pelvic pain. Pelvic pain is so common, and I know most of you can experience it, but it's not, I'm saying most of you, most of the people or most of the women can experience it. Another thing that will also happen is breast tenderness. That is also another sign which is common. We also have light spotting. If you are keen, you will notice it. Another thing, body temperature will change. When you are ovulating, your body temperature will cool, especially when you are at the peak of ovulation. Do you know the reason why? The reason why your temperature will cool or you will have low body temperature is because when you have high temperature, it can destroy the sperms when it is not favorable for the sperms inside your body. So when you are at the peak of ovulation, the temperature will tend to lower a bit, and also cervical mucus will change. How will it change? It will increase, or it will be more, or you will have a lot of secretion, cervical secretion, and this secretion will be white, clear, and stretchy. Yes, it will be white, clear, and stretchy, and it will be a lot or more. Yes. And another thing that will happen, you will have an increase in libido, or you will have an urge to have an intercourse. So you have to know all these signs and symptoms of ovulation when you are tracking your cycle. Don't just track your cycle without knowing the signs and symptoms of ovulation. How will you now try to get pregnant? And the next one that you have to do is have sex during fertility phase. Yes, have sex during fertility phase. You are trying to get pregnant. Don't waste your energy when you are not ovulating and you are trying to get pregnant. Reserve that energy until you are at fertility phase, and then when you have an intercourse, at that time you will get pregnant easily. Number 4, go to the hospital and check if your hormones have been balanced. If you have already come back to fertility phase, go to the hospital and check. The doctor will tell you that your hormones are balanced and now you can start trying to get pregnant. And the last one, you can use fertility pills, of which these fertility pills are not advisable to use because they always tend to increase fertility. You will end up getting 6-7 kids, which will be a wastage because sometimes you will not be capable of carrying this pregnancy to term. So if you have to use fertility pills, go to your doctor and consult with your gynecologist, and the gynecologist will advise you on the amount or will prescribe the right amount that you're supposed to use. Yes, so I think I will stop from there. If you have any question, write it in the comment section, and most important, don't forget to like, share and comment, and thank you for watching this video up to the end. Bye till next time.